Heroin isn't instantly physically addictive, in that you don't develop a physical dependence on it, with one dose. But you can have a lot of psychological dependence that can begin to develop even with the first dose. Heroin's different than other drugs that we see in adolescence, especially when kids come to Rosecrance and talk to us about their heroin use. They talk about it in a much different way. It's almost like it turns into a significant other. That their mind is they can't do anything except for think about heroin, think about where they're going to get their next fix, think about where what other people are doing with it. They almost use it in exclusively, sort of not living other parts of their life appropriate at all. It almost becomes so fascinated and obsessed by it that everything else is sort of lost with it. Heroin can be deadly. Prescription opiates can be deadly. I mean, there's a lot of ways it can kill you. Certainly the overdose is part of it too, but if you're using an IV, you can get infections in your heart, infections in other places. HIV is transmitted that way. Lots of times people, if they're using or they're high, they will have experienced some trauma while it's happening, whether it's somebody taking advantage of you or something involved with getting the drugs. There are a lot of consequences to heroin use, and certainly death is one of the most worrisome. And there is help. There's really good help available for people that are addicted to opiates, and so reaching out to Rosecrance or someplace else like that for help is important to do, and there's reason to have hope.